we can't wait for a complete system overhaul because it is going to be slow coming. And I think, rather than sitting and waiting, individuals working in the system and individuals who are being serviced by the system, consumers and families need to advocate for small changes and need to advocate for themselves and need to collaborate. I think, as well, Dr. Ishmael mentioned that collaboration is really important. And I think we can make small baby steps towards the ideal system that I think we need to see.
And I think we should also mention that the Schizophrenia Society of Ontario does have a program that is the Justice and Mental Health program, the JAM program, which Vani does head up. Can you just very briefly tell us a little about that?
Yeah, sure. So the Justice and Mental Health program was established about a year ago to serve families of people with mental illness who are in contact with the law. So like I said before, we've seen increasing criminalization. People with serious mental illness are coming in contact with the law at an alarming rate. And as a result, families are being affected as well. And there is no program in Ontario other than ours that specifically provides support to the families of those individuals. And I think that's really important because families often play a caregiving role. They assist their family member in navigating the system and that kind of thing. So when their family member comes in contact with the law, they often need assistance in navigating this new justice system. And as well, they often need emotional support as well. Sometimes families themselves are victims of crime, and even when they're not, having your family member become criminalized has huge impact on your family dynamic and your family structure. And so we really think it's important to provide that level of service to the entire family.
And if somebody listening wants to find out more, how do they go about doing that?
Yep, they can visit our website, www.schizophrenia.on.ca. They can contact myself. We have a family support worker as well, and we can help people by phone or by email or in person. And our support is available to families across Ontario.
And of course, there is the 1-800 line, which is 1-800-449-6367, if people want to know. Peter, you had a further question.
Just a comment, and it's really just an acknowledgement. As we talk about access to treatment, we're focusing clearly on the difficulties in accessing treatment, which we need to do, okay, because there's certainly room for improvement. But I've worked through over the years with a number of individuals that provide service at different levels, at community organizations, provincial organizations, primary care facilities. And I'd just like to acknowledge that there are some people out there that are really doing good work and really care about the people that they're trying to service. Sometimes they are as hamstrung by the system as family members and our relatives are. And I just think that's an important acknowledgement, because I wouldn't want the service providers out there to think that this is strictly negative about what they're doing. We're looking at a way to make service delivery more effective, access to treatment more effective. It's not a complete criticism of the system in its entirety or the people within it, from my perspective.
So just going around the table, where do you think we need to go? Vani?
This issue is so complex and so much needs to change. I think definitely the public needs to get on board. I think there needs to be greater awareness of the fact that people with schizophrenia can recover. I think a lot of people just assume that if you have a serious mental illness, then you're going to end up homeless and on the street and you'll never be able to work. And I think we really need to make people aware that recovery is possible, and that because recovery is possible, we owe it to people with mental illness to provide the care that they need. And so I think getting the public on board, getting the government on board, I think once this is a priority issue, things will really start to come together.
Great. And Peter?
Well, just to follow from that, I certainly agree that the idea of recovery needs to be brought across to the general public, because it does happen. Okay, it's a reality. It's not a philosophy. In a way, it is, but it's not imaginary. This does occur. People that are managing mental health issues can lead very rewarding lives, and the general public needs to realize that. Going forward, I think if that happens, the general public starts to see that, then people may be more ready to talk about it. Initial access to treatment may improve, again, because people are more ready to talk about it. And then going forward from that point, myself, I would like to see a much more integrated and holistic approach to recovery of mental health issues in general.
Great. Dr. Ismail?
I agree. I mean, I think early detection is in part very, very important to recovery. Early detection and treatment does result in a better outcome over the long term. So the answer to this question in part lies therein, and also within the biology of the illness. Our science needs to advance further in terms of biological markers of the illness and not just symptoms. That we need newer types of treatment, both medications and talk therapies that really impact on the illness as a whole, better detection, again, from a technological perspective as well, and then integration of all of that science into the larger community as a whole with better awareness, less stigma, advocacy for our patients, and an integration of them into our society as a whole and not marginalized as they can be right now.
And Michael?
Yes, I absolutely agree with Dr. Ishmael. From a consumer's point of view, early treatment intervention is crucial. Also, we have to educate government and society, obviously by providing information, correct information about schizophrenia. But you know what? Also publish, I think, success cases and testimonials of people who have almost been down and out with schizophrenia and somehow champion the illness and lead a fairly comfortable life.
So thank you very much, Michael. One last question for you all, starting with Vani again. In terms of the Schizophrenia Society of Ontario, what would you say is its role in terms of helping families?
I think that we play a large role in advocating for that family perspective, which is a really important one. And I think what's great about the SSO is that we don't have sort of an adversarial dynamic with sort of consumer groups or consumers. We really believe in sort of a holistic approach to care. We do provide most of our support services towards families, and while we do represent families in many ways, we also are very conscious of the needs of people with the disease living with schizophrenia. And I think in our advocacy work, advocating for public policy changes, that's a major role that we play, as well as a lot of the work that we do raising awareness about schizophrenia. I think those are two of the main things that we as an organization are able to do.
Great. And Peter?
From my perspective, I certainly support what Vani is saying. In addition to that, the educational services or supports that are put in place for family members have been very, very beneficial to us as a family. And in my delivery of that material to other families and the feedback we've received, I believe that generally people find a lot of value in that. So to continue with the family education and the family support services that SSO provides currently, and to improve on that, or to enhance that, not to